Hello coders, welcome to Fast Coder 21 Medical Coding YouTube channel. So today we are going to learn ICD-10 CM PCS Coding Clinic Updates first quarter 2023. As all of us know, in medical coding process, coding clinic plays a very important role where we will get more complex scenarios with answers. Usually yearly we will get 4 coding clinics. Today we are going to discuss about 2023 first quarter coding clinic. If you are visiting for the first time, please click on subscribe button to receive future updates. Please watch until the end to gain more in-depth knowledge. So this quarter coding clinic contains no new ICD-10 CM codes, which have already created one video which is in the FastCoder 21 YouTube channel. So I will keep that video link in the description section. So please watch that video in order to get insights about ICD-10 CM updates which we need to use from April 1st, 2023. Next, we have adult and child abuse, neglect, and other maltreatment confirmed and suspected. So basically, category T74, adult and child abuse and other maltreatment confirmed has been expanded with new codes to identify confirmed and suspected adult and child financial abuse along with the seventh character extension for initial encounter, subsequent encounter, and sequela as follows. So basically, T74.A1X represents adult financial abuse confirmed. If you take T74.A2X, child financial abuse confirmed. If you take T76.A1X, adult financial abuse suspected. So if you take T76.A2X, child financial abuse suspected. So basically, adult and child abuse codes are divided into whether abuse is confirmed or suspected. Next, we have perpetrator of maltreatment and neglect. Here, subcategory Y07.0 spouse or partner, perpetrator or maltreatment and neglect has been expanded and new codes are created for further describe perpetrator of maltreatment and neglect. So here basically Y07.0 series has been expanded. If we see here, Y07.0 spouse or partner, perpetrator of maltreatment and neglect. So first 0 belongs to spouse or partner, 01 belongs to husband, 02 belongs to wife, perpetrator of maltreatment and neglect, 03 belongs to male partner, perpetrator of maltreatment and neglect. So 04 belongs to female partner, perpetrator of maltreatment and neglect. Basically, these codes are expanded in 2023. Next, we have problems related to education and health literacy and physical environment. Here, a new code Z55.6 problems related to health literacy has been created, and also category Z58 problems related to physical environment has been expanded with new codes. Next, other problems related to housing and economic circumstances. So code Z59.1 inadequate housing has been expanded. Like we will use Z59.10 for inadequate housing unspecified, 11 for inadequate housing environmental temperature, 12 for inadequate housing utilities, Z59.19 for other inadequate housing. Next, personal history of abuse in childhood. Subcategory Z62.81 personal history of abuse in childhood has been expanded. So next one, patients other non-compliance with medical treatment and regimen. So subcategory Z91.1 patients non-compliant with medical treatment and regimen has been expanded. Next, personal history of physiological trauma not elsewhere classified. So here, subcategory Z91.4, personal history of physiological trauma not elsewhere classified has been expanded. Next, we have one guideline about COVID-19. So, as a result of the COVID-19 public health emergency ending on May 11, 2023, the financial year 24 ICD-10 CM official guidelines for coding and reporting will be revised to state that code Z11.52 encounter for screening for COVID-19 should be assigned for encounters for screening for COVID infection. This guideline change will be effective from October 2023. So next year we are going to have screening for COVID code which is Z11.52. Next we will check Q&As. Here first question, a patient was admitted for treatment of acute blood loss anemia due to gastrointestinal bleeding, likely caused by chronic non-steroidal anti-inflammatory drug NSAID use. 2 units of packed red blood cells were transfused. An upper endoscopy revealed non-bleeding gastric ulcers. The provider's final diagnostic statement listed acute blood loss anemia due to gastrointestinal bleeding. Since both anemia and GI bleeding were responsible for the admission, would they be considered interrelated and either condition selected as the principal diagnosis? Answer. It would be appropriate to sequence either the anemia or the GI bleeding as principal diagnosis. So basically here patient has red blood cells transfused. Here even anemia, whether it is anemia or GI bleeding, patient needs to have transfusion of packed red blood cells. So here we can code any one of the PDX, whether anemia or GI bleeding. So here medical necessity is reached in order to code anemia or the GI bleeding as the principal diagnosis. So based on our guidelines, when both anemia and GI bleeding are present on admission and meet the definition of principal diagnosis, either condition may be sequenced first, which is based on the official guidelines for coding and reporting section 2B. If we see here, when there are two or more interrelated conditions such as disease in the ICD-10 CM chapter or manifestation characteristically associated with certain disease, potentially meeting the definition of principal diagnosis, either condition may be sequenced first unless the circumstances of the admission the therapy provided. So here blood transfusion is the medical necessity for anemia as well as GI bleeding. So if you think technically also we can code any one of the PDX, either anemia or gastrointestinal bleed as patient has the blood transfusion. Next question. A patient presented due to spontaneous incomplete abortion. This patient also had a history of asthma which was evaluated and treated during the admission. An ultrasound revealed a 10 to 12 week uterus, which means first trimester, and a suction dilation and curetas procedure was performed. Would asthma be considered a pregnancy complication that would require an obstetric code from chapter 15, which is pregnancy chapter? So what is the answer here? No. An obstetric code from chapter 15 is not appropriate because the patient is no longer pregnant. As based on the question, patient is not pregnant and patient had incomplete abortion. So assign code O03.4 incomplete spontaneous abortion without complication for the incomplete spontaneous abortion. Also assign a specific code for the asthma. If a specific type of asthma is not documented, assign code J45.909 and specified asthma uncomplicated as an additional diagnosis. So basically here the question is patient has incomplete abortion and also patient has asthma. Here our question is can we code asthma as pregnancy complication or not? So basically answer is telling us that patient had abortion means patient is currently not pregnant. So we no need to code chapter 15 code along with asthma code. So as all of us know, we will code chapter 15 codes along with only pregnancy, not with abortion. Next question. A patient presents due to chronic kidney disease with acute kidney injury and bladder mass. The nephrologist documented CKD G4A3 with an estimated glomerular filtration rate of 25. Is the provider's documentation of CKD G4A3 sufficient to assign a code for stage 4 chronic kidney disease? So here the question is based on the acronyms can we code stage which is reported by the physician. Answer yes. Assign code N18.4 CKD stage 4 severe for a diagnosis of CKD G4A3. Here, the provider's documentation of CKD G4A3 is synonymous with stage 4 chronic kidney disease. So, if we find any type of documentation like this way, we can code as stage. This new categorization of CKD is referred to as CGA staging and is based on the cause, glomerular infiltration rate, and albuminuria. CGA provides a more detailed description of the patient's CKD and the number following G describe the stage. So if we see G here, G denotes the stage and for fourth stage. Guys, uh, please like, subscribe, comment our channel so that we can make more useful sessions in order to help all the coders worldwide. Next question. A patient with hypertension and end-stage renal disease presents for emergent dialysis due to fluid overload. The patient has been compliant with dialysis. Which condition is sequenced as the principal diagnosis? End-stage renal disease or fluid overload. So here the assign code E87.70 fluid overload unspecified as the principal diagnosis. Fluid overload is not inherent to end-stage renal disease. It is distinct problem and a complication of the kidney disease. Typically, patients in fluid overload who have ESRDs are treated with dialysis. Even our dialysis also performed due to fluid overload. So we can code fluid overload as the PDX using the medical necessity criteria. So here code E87.70 is assigned as the principal diagnosis since this is the specific condition that required admission to the hospital. The circumstance of inpatient admission always govern selection of principal diagnosis. So here we have medical necessity between dialysis as well as the fluid overload. The main reason for the encounter is fluid overload. So we need to code fluid overload at the PDX. Next question. An 83-year-old male with known cancer of the right lung with metastasis to the liver presented with worsening dyspnea and exertion and fatigue. The patient's lung carcinoma was described as poorly differentiated with neuroendocrine differentiation, non-small cell carcinoma favoring large cell with neuroendocrine differentiation as well as large cell neuroendocrine cancer. The alphabetic index under carcinoma, large cell, small cell leads to category C34, malignant neoplasm of bronchus and lung. However, the index under carcinoma neuroendocrine instruct to see also tumor neuroendocrine. What code is assigned for the lung cancer in this case? Here, assign code C7A.1 malignant poorly differentiated neuroendocrine tumors for the large cell neuroendocrine carcinoma of the right lung. Malignant purely differentiated neuroendocrine carcinoma of any site is an inclusion terms under C7A.1. Additionally, assign code C7B.8 other secondary neuroendocrine tumors for the metastasis to the liver. Next question. During an outpatient encounter, a 66-year-old male underwent an invasive cardiopulmonary exercise test. Usually we'll call it as ICPET. The test summarize states evidence of cardiovascular limitation due to preload insufficiency, which is most likely due to occluded inferior vena cava. A right cardiac catheterization was performed and the provided diagnosis preload insufficiency. What is the correct code assignment for preload insufficiency? Here we need to code R9439 abnormal result of other cardiovascular function study for preload insufficiency. Next question. A patient with bilateral traumatic above knee amputations underwent placement of stays first osseointegrated prosthesis for the rehabilitation of amputees device. Following incision, an osteotomy was performed. After reaming into the femur and tapping, the implant was advanced into place, followed by the central healing screw, the healing cylinder, and bone graft. The same procedure was done on the contralateral side. Would the principal diagnosis be the traumatic amputation with 7-character D subsequent encounter, or is an aftercare code assigned? Additionally, is insertion the appropriate route operation for the procedure? Answer. Assign code S88.011D complete traumatic amputation at knee level, right lower leg subsequent encounter, and S88.012D complete traumatic amputation at knee level, left lower leg subsequent encounter for the diagnosis. Here, the aftercare jet code should not be used for aftercare of injuries. For aftercare of an injury, assign the acute injury code with appropriate 7th character for subsequent encounter. The 7th character A for initial encounter is not assigned because the current admission for placement of the prosthesis rather than treatment of the original injury. So here patient has completed the complete treatment and he has prosthesis. So patient here came for prosthesis. So here we need to code subsequent encounter. Next question. A 75-year-old patient had previously undergone creation of tracheostomy that was subsequently taken down. Since that time, the tracheostomy site has remained open with greenish discharge without significant improvement. The patient is now admitted for surgical closure of tracheocutaneous fistula. What is the appropriate ICD-10 CM code assignment for a tracheocutaneous fistula following tracheostomy reversal? Would the fistula be coded as persistent postoperative fistula or complication of the tracheostomy? Answer. Assign code J39.8 other specified disease of upper respiratory tract, as this is the best available option to specify the site of the fistula. The intent of the procedure is to create fistula, and failure of the stoma to close spontaneously is not classified as a persistent postoperative fistula nor as a complication of the stoma. Therefore, code T81 series persistent post-procedural fistula initial encounter is not appropriate. Thank you guys. Thanks for watching Past Quarter 21. I hope this session is very useful for you. Please like, comment and share.